pet, but I consider them a different subject. As Rob mentioned this morning, when you're dealing with birds, everything with feathers is not the same. Gallinaceous birds, ratites, psittacines, passerines all have different sets of diseases. They may have the same etiologic agents. The presentations can be different. It can become somewhat of a problem, and even in the psittacine, in the psittacidi, I can never say that word, which are all parrots basically, but parrot is really not a good thing. If you're the pathologist and you get the tissue in and it says species parrot, they're not telling you anything. That can be anything from Budgerigar to a macaw, and it makes a difference. It makes a difference in how these diseases present. It makes a difference in what you're going to look for. It may make a difference in which organ you're going to look at. So you need some background. We can have the lights. Basically for pathologists, this is it on types of birds. I show these to my clinical colleagues and they get a little upset with me, but anyway. So we'll talk about avian infectious diseases, and we'll start with viral diseases. And we'll cover it this way, not exactly in this order because I was either asleep when I made it up or whatever, but we'll cover these plus some questionable or unclassified viral diseases, and we'll start with avian poxvirus. And you've already had a couple of sessions on poxvirus today, both in birds and in swine. This is a problem in all avian species. There's probably some cross-reactivity between these various avipox organisms, but in general, we consider that that fowlpox is not turkey pox, is not parrot pox. But all of these birds get pox virus. The classic presentation, and the thing that we see an awful lot of, is passerines, canaries, and small finches. And the typical thing that we see is, well, for the external lesions are like you see in many others. In passerines, there's two problems. One is that not all of these birds will have external lesions, and two is, of course, that when they have internal lesions, when it becomes systemic, this can be a very debilitating disease to the canary breeder. And some of these people, as you can imagine, may have thousands of birds, and when they start not only just losing them, but when they start having all kinds of other problems, one of the things you have to consider is pox. Typical external lesions: eye, beak, foot. And they are proliferative, they are variably necrotic. This one's been going on for a while. There may be secondary infections on the surface, and one thing you have to be careful of when you're getting especially biopsy material from practitioners who aren't used to this, who aren't exactly sure what they have, is they'll tend to get the top of this thing off, and then when you get it, you're looking at bacteria, you're looking at necrotic debris, you're looking at a lot of junk. You're not seeing any changes of the epidermis because they haven't sent it to you. And that's something you have to work with them. So that's fine. If you've got the superficial lesions, it's a relatively easy diagnosis to make. If you have systemic lesions, one of the things that you really need to look at is the spleen. And in passerines, the spleen is a narrow, long, tubular organ. This is the ventriculus, this is the proventriculus. You can appreciate in most passerines, the normal spleen might go from about here to about here, and you can appreciate the size of this thing. This is one hallmark, generally speaking, of systemic pox in these birds, is a tremendously enlarged spleen with a tremendous proliferation of lymphoid cells. Histologically, these cells almost look pseudo-neoplastic. They're very blastic looking and very proliferative, and you can see here that all of these are foci of lymphoid cell proliferation. You can have a variety of changes with systemic pox in these birds. You can have pneumonia, you'll have wet lungs, and some consolidation. Okay, let me back up once on that one. Pneumonia and some consolidation. You usually will not see other specific gross lesions of pox. You can find, and we'll see some down the road a little bit, you can find histologic changes in the upper respiratory tract, in the oral cavity, in the bursa fabricius, and in a number of locations. The wet pox presentation of poultry I've seen in some canaries, but I don't see it very often, and we'll show some of the parrot pox in a little bit. You also see pox in a variety of species, just to illustrate your pet ostrich and your parrots. One of the presentations in cytosines is conjunctivitis, and this is how it looks, and you can probably appreciate from that that there's nothing specific here for pox. Circovirus infection, if it involves the conjunctiva or the skin around it, can do this. A variety of other things potentially can do it. Mycoplasma is often talked about in cytosines and rarely proved. Bacterial diseases can also be a problem. A little more severe, I'm beginning to see more necrotizing lesions and changes that might look more pox-like. With lovebirds, you have agapornipox, which very characteristically will be in this location and will give you these various lesions which are proliferative and crusty and hemorrhagic. All right, you can, and particularly in the blue-fronted Amazon parrots, for some reason blue fronts are heir to a lot of diseases. I don't know if it's their immune system or what, but we see a lot of, when we find classic wet pox and cytosines and systemic pox and cytosines, it's usually blue-fronted Amazon parrots, and it's usually birds that have come in through quarantine, they've been stressed, they're young. This is still one parrot that there's a lot of, and there's still a few of them coming in. A lot of the cytosines today are all captive bred. They're not coming in anymore, and so it's a little different picture. Getting ahead of myself. Changes in the tongue, changes back in the oropharynx. You can get really severe necrosis and a lot of caseated looking material. This goes right on down the esophagus into the crop and into the proventriculus in some cases. It can be very severe. And in these birds, this is, it's usually a fatal situation. All right, the characteristic lesion, which you've seen already, is a proliferative dermatitis. Large epithelial cells, and even at this magnification, you can appreciate intracytoplasmic inclusion bodies, usually eosinophilic. You get a variety of changes in the dermis that are mononuclear to mononuclear plus heterophilic, depending on whether you've got a secondary bacterial infection or not. In most of the exotic species that I've seen, the inclusion bodies are really pretty easy to find. I'm talking about the birds now, pretty easy to find. It's not like you find in some of the, in sea lions, some of these other critters where you really have to convince yourself you've got inclusion bodies, but it's really pox. And here you can see more of the same. This is from a canary that had systemic, they were losing them. They had some kind of systemic disease, nothing externally. Went through a few of these birds, not much internally. This was the only definitive lesion, and here we are in the nasal cavity. And this is nasal mucosa, and here's your pox lesion. And in terms of identifying what was going on in this bird, this was the only one. And in these small birds, what I tend to do when we have this problem is I tell them, I've got to have the head, and I've got to section it and do several things to it, because if they just go through and pluck out a few things, if you get lucky, you might find some specific lesions in the lung, microscopic. If you don't, why, you've missed it. Now there's more pox virus occlusions and more. Interesting, strange things. We had one come in one time where the keratin of the Rhampotheca had just sloughed right off, and then they euthanized the bird, and they sent in the germinal epithelium of the beak, and sure enough, he just had a pox virus infection in there, and that was the only thing we saw. So it's a disease that can give you a lot of different looks, inclusion bodies. The inflammatory lesion that you can see in this, not in the skin now, because that can be, as far as I'm concerned, can be mixed with the bacterial problem. But when it goes into the deeper tissues, and particularly when it's in the oral cavity or in some other areas where it extends, the inflammation extends on into the submucosa and then on into the muscle, is this very mononuclear, lymphoblastic, almost neoplastic looking. And it'll infiltrate striated muscle just like lymphosarcoma will, and it's quite an interesting lesion, I think. If there's any questions about any of this, speak up while we're talking, and so that we don't pass slides or miss a point and I need to go back to it. We got plenty of time, I think, and we can pretty much cover these. So, any questions? Yeah.
When you cut in the head on the casserade, how do you section it? Do you
I section it longitudinally, and it depends on how old this bird is. If he's young enough, you can pretty much get away with without doing anything. You can section it and process it. If he's an older bird, I section it, and I'll give him a very short in the decal. I mean short. Bird bone decalcifies very readily, especially small bird bone. And an hour, hour and a half maybe sometimes will be enough. Then I go ahead and make a longitudinal section through, try to get most of the head, include the brain and the whole 9 yards, and then just put it on a slide.
So on your slide, you're just looking at kind of the midline?
A little bit off usually, but one side or the other.
Thank you.
Sure. The Papilloma virus group, Polyoma papilloma or papilloma polyoma, includes 2 subgroups, and the big problem in pet birds is Polyoma virus. This is a real problem in cetacine birds. It's probably, if not number 1, it's number 1.5 in terms of the infectious disease problem in this country. It is also becoming a problem in passerine birds. We're seeing it in canaries and finches more and more, actually. And this is a virus that will affect all varieties of cetacine. The classic lesions, the ones that you read about in the books, some of what I will show you here are the ones seen primarily in eclectus parrots and in macaws. There's a lot of variations in this disease. That's why I say you have to know what kind of a bird you're looking at. Liver lesions are a hallmark of this in many of these species, but if you get a cockatoo or if you get a cockatiel, then it's different, and they may not be as good, and you may have to look around and look at other things. And you get several presentations. Polyomavirus, originally, the original cetacine reports were called Budgerigar fledging disease. You'll find this in the literature. You'll also find the old term French molt, which was, in my opinion, an amalgamation of probably about 5 different things, and I think it's a real bad term. I don't like it. And I don't like Budgerigar fledging disease for the same reason. Because now we can pretty well separate these things out and decide what they have. And in Budgerizars, it's usually polyoma or Circovirus or a combination. This is an eclectus, and we've got some feather problems, and they start looking moth-eaten, and they have the feathers that won't completely ex-sheath and what have you. In most of the larger parrots, polyoma as a skin problem without systemic manifestations, really I don't see very much of. Occasionally, but not very much of. It's the skin problem is usually the small cetacines. And in these cases, what you see, generally speaking, in the epidermal collar of the feathers, or perhaps in the follicular epithelium, is Caryomegaly, and in particular in internuclear inclusion bodies, which vary from being almost clear to has been described as a ground glass or granular, slightly basophilic appearance. They're irregular, generally speaking, and we'll talk about it more with the internal lesions, somewhat irregular. And really the only thing in terms of inclusion bodies, the thing that you might, and we'll look at this again down the line, want to worry about is adenovirus. Make sure that you're not dealing with adenovirus. I think that most cases you can tell the difference on light microscopy between the two. We do see some cases where there's a kind of a generic viral inclusion in some of these livers, and without an in situ probe or something like that, it's pretty hard to tell. This is a good example of what's happening here. This is in the follicular epithelium. Okay, what do we usually see in these birds? We have a bird that's young cetacine. This virus, generally speaking, is horizontally transmitted from adults that are carriers. They're shedding the virus in the feces primarily, and these little guys are picking it up, and what's happening is they're getting exposed to it as whatever maternal antibody they may have had is dropping off, and before they're really getting their own immune systems going. And so they get hit with it, and you get a very sick bird within, the only history you may get is he had a slow crop last night, and this morning he's dead, and that's it. When you open them up, you see a varying number of things: edema, subcutaneous, and hemorrhages that are both subcutaneous and intramuscular. The hemorrhaging is really to me, a very typical and classic sign. If you get this much hemorrhage, I think you immediately, polyoma goes to the top of your list. I've seen occasional birds with chlamydia that'll do this. You don't see this kind of hemorrhage with adenovirus. You don't see this kind of hemorrhage with circovirus. You don't see it with Pacheco's. You can see hemorrhage with Pacheco's, and we'll contrast them as we go along. You can find hemorrhage in the oral cavity. You can find hemorrhage on the heart and basically on a lot of serous membranes, heart, air sacs, peritoneum, and what have you. And you also, in most of these birds, you have gross changes in the liver. You may or may not have a thickened hepatic capsule and air sacs. This is really nothing I wouldn't want to hang my hat on if I saw that, because there's a lot of diseases that can look like that. Chlamydia, bacterial infections, and you've seen a lot of them with the poultry today, and they look the same in most of these parrots. So if you've got just a serositis, you've got a lot of differentials to think about. When you start seeing a large liver that is slightly mottled out, before we go on with the liver, we'll finish up with the heart. The hemorrhage microscopically looks just like hemorrhage microscopically. You have a varying amount of myodegeneration, and in some of these birds you will have inclusion bodies in the myofibers. It's not a consistent finding, but you do see it. The most consistent, out of place, but the most consistent organ to look for inclusion bodies, in my experience, is the spleen. I like them to send the spleen. And this is true no matter which bird it is. In some birds you will find inclusions in the liver, and in others you never find them in the liver. But I really like to look at the spleen and maybe secondly the kidney. But you can find inclusion bodies of polyoma in just about anywhere there are reticular cells or endothelial cells or what have you. I've seen it in the bone marrow and in the bursa and in a lot of places. We'll see some of those. So we have a varying amount of hepatomegaly, and we may have a look like this, which is pretty nonspecific in terms of what it is. Might look like, yeah, you've got an infectious disease. You can get one that looks like this, and you might think, well, yeah, I may have an infectious disease, but I might have a fatty liver too. This one is also Polyoma Virus. And if you're lucky, you get one that starts looking like this. And you also notice that you've got hemorrhages on the lung, hemorrhages everywhere, and it was a good case. You've got a certain amount of ascites, and the ascites can vary. The first time someone opens up one of these birds that's got a lot of ascites and he's been dead for a while, he's got a nice gelatinous mass around his heart, and they get real excited about it. The cytosines that acidic fluid will gel in a real hurry, and that's all it is. When you start looking at something like this, with this pattern of necrosis, the classic lesion, I won't say pathognomonic, but almost, is that this is a disease that causes mid-zonal necrosis. Now that's fine if you've got an eclectus or a macaw or a lovebird. As I said, if you've got a cockatoo, it may be mid-zonal, but it's here, there, and the other place. It's not diffuse. If you've got a cockatoo, it's probably not necrosis at all. You've got something that looks like a slightly fatty liver microscopically. When you get one like this, why, that's pretty characteristic. And here's what we're looking at. There's a little bit of sparing of hepatocytes around this portal area, a little bit of hepatocyte sparing there. This one's pretty severe. It's almost a massive necrosis in this case. It's necrosis and it's hemorrhage, and it rarely is very inflammatory. You can have inflammation, but not very often. A few cells, a lot of that may just be reaction to the necrosis. And just another shot, that's the necrotic areas. And you can see that these things form a pattern and kind of grid out through these livers, and well, just again, so that you can see that the pattern. And this kind of pattern, if you're looking at a slide, if you're given a slide to diagnose, and you're looking at this kind of pattern, even if you can't find inclusion bodies, or if you only find one you think's an inclusion body, I mean, this is the disease that ought to be right up on top in terms of your differential diagnoses. All right, the spleen. The spleen is usually always enlarged. It can be pale, it can be necrotic, it can be hemorrhagic, but it's almost always enlarged. The pattern of necrosis in the spleen varies tremendously, both between species and within individual cases. This is a real severe necrosis, real severe reticular sheath necrosis, and a lot of congestion, hemorrhage, if you will. Trying to decide if a bird's spleen is hemorrhagic microscopically is kind of difficult. And you can see here that we're starting to look at now, this one's got changes in the nucleus. We've got karyomegaly. We've got this little bit of chromatin margination. We've got some granular looking stuff. And yeah, that's a suspicious nucleus. This is just another pattern of splenic necrosis, a little more diffuse. And then you get one of these, which is really the one you want, where almost every reticular sheath cell and every other macrophage or what have you that you see in there is full of these things. And the nice granular ground glass look to it. And you can see that these things are irregular. There's difference in size and difference in shape. It's just another shot of the same kind of stuff with these. And that's the kind of inclusion body. And if you see anything, if I go through one of these birds and he's the right age and he's got kind of the right sort of history, it doesn't take too many of these to make me fall off on the side of Polyoma virus. You can get, particularly in cockatoos, you can get a pneumonia with Polyoma virus, and you can see hemorrhage, you can see necrosis. Sometimes the necrosis is because they've lived long enough to set up a secondary bacterial problem. But there's collapse of the air capillaries, there's congestion, and there's a lot of, you can't identify the cell particularly. They're probably endothelial or reticular cells. There are inclusion bodies. But the pulmonary lesions, to me, are more a cockatoo, the cockatua rather than era or whatever the neglectus is. Bursa fabricius, and the bursa fabricius is a real important place to look in diagnosing infectious disease in pet birds, in any kind of bird, I guess, but in pet birds, particularly in citizines perhaps, although I'm sure in passerines and the others. The bursa in the citizine doesn't have the short, they're not like chickens, okay? At 1 year of age, at 13 months, at 14 months of age, you can still find a very well-developed bursa in a bird that's perfectly healthy. So anytime the bird is, and I tell my clients, if you got a bird you're posting and he's less than about 14 months of age, you just almost have to send me that bursa because there's a lot of information to be had. In Polyomavirus, this is a horizontally transmitted virus. It hits them hard, it hits them fast, it kills them. The bursa has attained its normal size. It looks good. There may be some hemorrhages. That's not a good slide, but you can see the hemorrhage. And you can see that this bursa is normal size, looks good, looks like a really good bursa. And microscopically, the bursal follicles are the size you want. And what's the problem? Well, all the lymphoid cells have gone. You can see the follicle-associated epithelium quite well, and you can see the reticulum, but the lymphoid population has been trashed, basically. And this is an extreme example, but this is what you see. And variably in these birds, you'll find the reticular cells with enlarged nuclei, chromatin margination. The inclusion bodies are usually not very good, but the nuclear changes are there. And this is, as we will contrast when we talk about Circovirus in terms of the mode of transmission of the virus and what it does to the bursa. This is the thing you look at with polyoma. Now, occasionally you see a polyoma bursa that really looks much differently, and that may be the rare case of a vertical transmission or some other problem. Just another example, not quite as bad. Still have some lymphoid activity here, but you can still see that the follicle-associated epithelium is quite prominent. And that's what I look at if I get on there on Lomag and I'm looking, and if I can start picking that out, then I start looking further. If I don't pick it out, if everything looks good and I can't see it, then we've probably got a normal bursa. The kidney, you do get glomerular changes. This isn't, I just had a case recently that I'm going to try to get into the set because it's really got some nice, it's got a glomerulonephritis, and it looks like a membranous type glomerulonephritis. There's mesangial thickening, and mesangial cells in the glomeruli will have chromatin margination and internuclear inclusion body formation. Rarely you can see tubular cells, but primarily it's mesangial cells in the glomerulus, as opposed to the cockatiel and Budger-Jar adenovirus that you'll look at that is a tubular inclusion body. You can get lesions in the brain, and here we have hemorrhage, and here we have a nice inclusion body, probably in an endothelial cell. If you do a DNA in situ, that's just a gee whiz. You can do that if you're really worried about it. This one was positive for polyoma. You can do electron microscopy, see the viral profiles. You have to do some measurements on these because polyoma and adeno and EM are close enough that you can't just kind of look at it and say, oh yeah. There is another polyoma, possible Polyoma syndrome that I have been seeing, a few other people have been seeing, primarily in cockatiels, occasionally in Budger-Jars, occasionally in some other parrots, once in a while in a passerine. That basically is tumor formation associated with Polyoma virus. In what way, we don't know yet. In the cockatiel in particular, it seems to be almost primarily lung tumors. And we see some of these as aviary problems, more than one bird, and that's kind of strange. This is, I apologize, this is a fixed specimen. It's the best one I have gotten my hands on so far. And this is what remains of lung, and this is neoplasm. These things microscopically are just, they're malignant undifferentiated tumors. Sometimes they look like carcinomas, sometimes they look like sarcomas, sometimes they look like carcinosarcomas, and sometimes they look like, as a friend of mine used to describe, carcinosarchitis. Take your choice. But you can see these nuclear changes. We've done electron microscopy on several of these. The virus is there. Not always there. And the question really is this a tumor where the virus just happened to be in the cells and it's just there, or is this really a polyoma virus-induced tumor? Well, polyoma virus can induce tumors, so it may very well be. And I'm interested in the fact that it is primarily, from what I've seen so far, a cockatiel problem. A few others. I've seen some liver tumors and budgies, a few other things, even one brain tumor in the finch. So there's something out there to be worked on. To remind me that the other member of the well, before I go on to the other member of the Papilloma virus family, any questions about polyoma?
Have you done any stains for cytokeratin or desmin, those types?
Yeah, not on that particular one yet. I've done that on bird tissues. I'm not convinced in every case that we're getting good, that it's working. But I haven't tried it on these. Yeah. I would like to get someone interested to do a little more of this kind of stuff, but most people, the owners of these birds, can't foot the bill for what it would take to get me to do it. And so I'm hopeful that someone that's got the facilities sometime will take it on to work it up. I've been talking to Dave Graham at Texas and the guys in Georgia and saying, hey, let's do something with this. The other member of the Papilloma Virus is the Papilloma Virus. Now, proved Papilloma Virus in cytosine birds comes down to papillomas seen on the face of African gray parrots. There's a lot of talk about choanal and cloacal papillomas, and people have tried to associate it with Papilloma Virus, with Herpes Virus, with this and that virus, and it may well be associated with virus, but no one has yet found or proved in any way, shape, or form that there's a virus there or ever was. But in African gray parrots, you see these things on the face, and they've been proved. I also see morphologically similar papillomas on the face of cockatiels and other cytosines. I suspect it is probably viral. Probably Papilloma virus. And this a classic papilloma. Sometimes they're not so classic, but this is one. This is from an African gray parrot. You really don't get the nice, in some papillomas, as you can see in dogs or anything else, sometimes you get the nice nuclear changes. You just know there's something going on in that nucleus. It almost is an inclusion body, and I haven't seen it in these. But there is that papilloma virus, and they just look little warty things grossly, and I apologize, I don't have a gross photo. All right, Circovirus. Circovirus in the literature, Cockatoo beak and feather disease, cytosine beak and feather disease. I'm more in favor of Circovirus infection because we also have Circovirus now in pigeons and in passerines. And we'll spend most of our time with the cytosines because that's where it's a problem. And the classic case was the cockatoo with no feathers and immunosuppressed and sick and one thing and another. And the typical presentation is this kind of situation. It varies. Beak and feather disease, yeah, and I'll show you some beak lesions, but the beak lesions probably occur a lot less often than the feather lesions. And people have tried to call it feather and beak disease. Well, let's just call it Circovirus. Classically, loss of feathers, feathers that will not exsheath, feathers that have these pinched off areas. And what's happening, well, we'll see what's happening, but what's happening is that there's a change going on in that feather that's really not specific. That is not pathognomonic for the virus because there are other ways you could create that lesion. But for all practical purposes, this is the one thing that usually does it. $10,000 worth of bird, $20,000 worth of bird, black palm cockatoo, too bad. This bird, this bird is, I think, still alive. They've kept him going for years and years just because they couldn't bear to pop him in the head. But they have to keep him away from everybody else. And this is an example of the beak lesion, severe necrosis, variable. These beaks will partially slough and what have you. And back to the feathers, just a little higher mag of some of these feathers and some more. Eclectus parrots, lovebirds, not sometimes quite as dramatic in lovebirds grossly. Microscopically, lovebird has a tremendous inflammatory, probably the worst inflammatory response in most cases is that I see is with lovebirds. There's a tremendous parafollicular dermatitis, mononuclear primarily, and a lot of feather pulp inflammation. So what do we see? This is the skin. This is the feather follicle. This is the epidermal collar of the feather, and that's the pulp. And you see that in the epidermal collar, you've got these things look like the moths have been in here, and then you've got these darker foci. And then you've got some cracks that are artifact. But these areas of necrosis in the epidermal collar, you can see things that look like intranuclear inclusion bodies. It does occur in this disease in the feathers. You can see some cytoplasmic inclusions. We'll see a number of those. Sometimes they're pretty trashy. Sometimes there's just one or two. It's another epidermal collar. Generally speaking, the cytoplasmic inclusion bodies are in macrophages. This is material that the macrophages have picked up. The intranuclear inclusion bodies are in epithelial cells. I don't know if they've changed their mind, but for a while, the word from the researchers was that up to the point of seeing cytoplasmic inclusion bodies, that the immune systems of these birds still had a potential for recovery. And we indeed have seen some birds that had gross lesions that were diagnosed on biopsy that did recover. And they had necrosis, they had inflammation. They might have had an intranuclear inclusion. They didn't have any cytoplasmic inclusions. It doesn't happen very often, and I'm not sure whether they've changed their mind on that. And then these are the more typical inclusions that you'll read about, the grape clusters or whatever you want to call them. They're basophilic, they're globular, and they're in the cytoplasm of these cells. You can also see that you get a pleocellular response in the feather pulp. There's a good shot of these things. Now, this type of inclusion, I'll show some down the line, you can see in other locations in systemic disease, and you can see them in other birds. Even though pigeon, cytosine, and passerine Circo are immunologically distinct, and the tests, the DNA probes that they use for cytosine diagnosis will not work on the pigeon or the passerine stuff. Histologically, this looks the same. Some variations. That's what it looks like on electron microscopy, and you can see these profiles and what have you. All right, what about the bursa in these birds that are affected? We have systemic disease in some of these birds, and in fact, in particular in African gray parrots, in young African gray parrots, we have a situation where a lot of times you don't see the feather disease. For years, people didn't think African gray parrots got the disease, and that wasn't true. Same with Amazons, and I think we proved that it did. We presented a couple of cases of both Amazon parrots, and now you see it a lot in African gray parrots. But in young African gray parrots, they may not have feather problems, but they're sick little birds. You've got a small bursa that's contrasted with the Polyoma Virus bursa, and you can see that what's happened here. These bursal follicles are irregular. A lot of them are small. You see a lot of the bursal connective tissue and the interstitial tissue. This is usually a vertically transmitted virus, and it's been working on them for some time. And in some cases, these follicles probably never really developed fully. In some cases, they may have, and then they regressed. But some of them never developed. So this is a bird that's immunosuppressed. He's weak. He is, or she, is susceptible to a lot of secondary problems, bacterial infections, fungal infections. For a number of years, I'm quite convinced that a lot of African gray parrots in particular, some other birds also, have been diagnosed with bacterial septicemia or mycotic disease. Nobody ever looked at the bursa, and they missed what was really going on. And I'll show some examples of how that can happen. We may need, we need the next one. It's marked number 2 back there.
Do you have serologic tests for these diseases?
There are serologic tests for, the Australians have developed complement fixation tests for circoviruses, but there's a lot of problems and a lot of arguments about whether they're worth anything at all. And it has to do with this particular virus, and I will admit that I don't understand all I know about the argument or why, but they've never been well accepted in this country. And of course, we have the DNA probes, and they have a blood test with a DNA probe, and it's really a very superior test. And you can get false negatives, you can get false positives in certain situations. more false negatives than ever a false positive is usually a lab error. A false negative, if you have a very early infection or an overwhelming infection, or for some reason it's cleared, the leukocytes aren't carrying at that point. But DNA testing for this disease is widespread now and is really leading, I think, will eventually lead to a lot less of it. But it's still out there.
So this is vertically transmitted.
Yep.
Are they doing that test for breeders now?
Yep. Yep.
So,
And that's the idea will be eventually to get this breeding stock all clean.
so how do these birds, if you get it when you're a baby, some must survive?
A lot of them survive. They'll become carriers and on they go. And interestingly enough, however, some of them at 17 years of age, 20 years of age, they get stressed, they break, they got clinical disease. And remember, we're talking about birds in talking about cytosines. I know with you guys, you chicken guys, you know, if you got a 3-month-old chicken, it's an old chicken. Well, I'm dealing with a lot of birds that are 8, 15, 25. I've seen birds 80 years old. So this is long-term commitment if you want to own birds. Anyway, what do you see in these in the bursts of these birds? Well, you see necrosis and you see these inclusion bodies, which aren't quite as clean as the ones in the feather, but there's really no doubt about them. That's what makes your diagnosis is the inclusion bodies. If you don't have them, but you have an African gray parrot and he's about the right age and everything else, then this is one of your differential diagnosis. Proventricular dilatation syndrome would be another, what have you. So why was it it wasn't misdiagnosed, it just wasn't diagnosed for years? Well, you were presented with a bird that had a liver that maybe looked like this or like this, and they honed right in on it, and they got pieces of that liver, and it was bacteria city, and oh boy, we got some kind of gram-negative septicemia. Yeah, you do, but you do because he was immunosuppressed. So if you as the pathologist are on the receiving end of these tissues, and they're not sending you those burses, and it's an African gray or a cockatoo or pretty much any of these little cytosines, you know, go beat them around the ears and tell them that you need it. You can get Aspergillus pneumonia. This is a case of Aspergillus pneumonia in a bird that had Circovirus. Again, they get entranced with the lung lesions, and that's what you look at. Any other questions about Circovirus? I think I should mention in terms of pigeons, it's an immunosuppressive disease. It's seen that the worst lesions are in the young birds. You also have the bacterial and fungal secondaries that tend to muddy up the water. You really need to look at the burses in these pigeons in order to make a diagnosis. If you get lucky, and I've seen the inclusion bodies out in the intestinal lesions and in other places, but the bursa is where you need to look. We have seen now, I've seen 3 outbreaks in canaries, 2 in canaries, 1 in finches, and 2 in canary aviaries where they just literally decimated the aviary. They could not raise anything past 3 or 4 months of age. And again, the bursa is the tip-off. The canaries tend to have some feather lesions. The necrosis and the pattern is there, and you get real suspicious. I've never seen an inclusion body in the feathers. The pigeons, I don't think anyone's ever seen a feather lesion in the pigeons. And it's probably, that virus is probably out there in other birds too. All right, Adenovirus. In the species I deal with, and Adenovirus, again, is a problem with all avians, really, but in the species I deal with, I see it most often in Senegal parrots and their relatives as a systemic disease or as an aviary outbreak. And adeno will give you aviary outbreaks somewhat sporadic. Here's a bird, we're in a time frame of a couple of weeks. It's not like Pacheco's that'll go through and wipe everybody out, or Polyoma that'll go through and wipe everybody out if you got young ones, but it's sporadic disease. Senegal parrots and their relatives. I see it in budgies and in cockatiels as incidental stuff. They die, they're young, they're probably immunosuppressed, and what you do is you find some inclusion bodies, usually in the kidney. You may find a little nephritis. We'll see some of that. Adenovirus primarily is hepatic and enteric in these birds, and the liver is, you start looking at these livers, and they're all going to run together. And on gross, if you're faced with a parrot and a liver, you've really got to have a list here of viral, bacterial, chlamydia, and they're going to have to give you, if they really want you to come in on the disease, they're going to have to give you some clues. So you've got to know a little bit something about what else is going on. You can see that this liver has these dark areas and light areas. It's variably necrotic. you can get a look like this, and it's multifocal necrosis, and you see something that looks like this. Or you get multifocal necrosis and you see these things. Big basophilic intranuclear inclusion bodies that are indeed adenoviral inclusions. These confuse people. I've had slides sent to me saying, you know, we think we've got this really weird protozoal disease in the liver. No, you got adenovirus. But it's this kind of an appearance. And again, as I say, you think about the Polyoma virus. These are, generally speaking, in the liver, much more basophilic, and they tend to really round up. They're not quite as pleomorphic. The nuclei aren't. So I feel reasonably good in most cases in calling these, and I've had it checked a couple of times by people doing DNA in situ and what have you, and it's so far so good. So. And this is an example of the inclusion bodies. So multifocal necrosis, it's a pattern that's different from the polyoma pattern. It's a pattern that's different from what we'll show you in Pacheco's disease. The enteric disease is necrotizing, maybe hemorrhagic variably. You can see a lot of mucosal necrosis, and you can see even at this magnification, you can see the inclusion body formation. Here we are again. Some of these birds, when they present, will have a bloody tinged fluid from their vent. Be aware, however, that Polyoma virus in some rare birds can give you the same necrotizing enteritis, and so it's grossly, you're still looking at those two for, you've got to go further than just the gross. Again, to me it depends on the species and perhaps on the age, although the Senegals that seem to have most trouble are, again, the little ones. Occasionally we see these somewhat more eosinophilic inclusions in renal tubular epithelium. This is the thing I see in budgies and cockatiels, and usually there's minimal, these are dead birds and there's no other lesion, and I really kind of blame adenovirus. I think they're immunosuppressed and they're weak and they just don't make it. But you get people argue about that. I've seen it as a neurologic disease. This is adeno in a cockatiel. You can see some inclusions in the endothelial cells just like you do in dogs. Okay, we'll talk about, well, let's go on. We'll go ahead and run it for a little while longer. Herpes virus, and I'm going to talk about 4 different manifestations of herpes virus. The classical, what you think of as the typical, is Pacheco's disease, which is the thing we see most in this country. There are different serotypes of these herpes viruses, however, and you really have to have a good virologist to tell them apart. People will try to tell you, well, if the liver isn't quite as involved and the intestine really is, it's probably a different one and all that. You know, maybe. But as far as I'm concerned, it's probably most of it's Pacheco. I've seen some of those outbreaks where people are saying, well, it just didn't look like typical, and then we do get a virologist to look at it. Yeah, it's Pacheco's. But the classic thing here is, again, it's hepatic necrosis. And you may get hemorrhages, but these are petechial hemorrhages. Petechia on the epicardium, petechia in the mesentery and on serosal surfaces. It's not those big effusive hemorrhages you see in Polyoma virus. It really looks different. Even when it's all over the place, it looks different. But the liver, on the other hand, has a real wide variety of looks, and you just can't be totally sure. It's just another one with more of the hemorrhages to illustrate more of the hemorrhages. Usually, in the case that you would be typical, is really a pretty massive necrosis of these livers. And you look at it on low power and you say, you know, you're not getting any details. And variable inflammatory response. And here's the picture. It's just very necrotic. And then you'll start picking out inclusion bodies in viable hepatocytes. We had a conversation the other night about what happens when you don't see any inclusion bodies. Sometimes you don't. I always go looking for the bile ducts because I always feel like I can find them in the bile ducts if I can't find them in the hepatocytes. And there's usually some bile duct somewhere that's intact, and you look at those, and that's where it is. Now, occasionally, I've had a bird, and I still thought it was Pacheco's because we had the hepatic necrosis. And I didn't find hepatic inclusions, but I did find some in the pancreas or some other places. And you can find them in the intestine. We'll look at a variety of these things. And this is a different looking inclusion. There's 2 types, back to the old classic type A and type Bs, and you'll see both. You don't really have karyomegaly. You don't have real strange looking nuclei, but you see the one with the halo and the one without. And those are the kind of things, if you're going to get stuck with a slide of this disease, that's what you want to look for. You get splenomegaly, splenic necrosis, just a couple of different looks. They can be variable. You can get multifocal. You can get a pancreatitis, and you can get multifocal areas of necrosis and hemorrhage in the pancreas. And you can see inclusion bodies and syncytial formation in the pancreas. I rarely see syncytial formation in the liver, but I see it in the pancreas, I see it in the intestine. And you sometimes can get a very severe necrotizing hemorrhagic or necrohemorrhagic enteritis, and the intestinal, particularly the small intestine, will fill up with blood.
In that case, are the lesions present in the parenchymatous organs?
Usually, but sometimes not quite as severe.
So that would have been so much.
Yeah, yeah, and yeah, right. And when you see it, if you find an intestine that isn't autolyzed, what you really have is wall-to-wall cells, necrosis. You hardly can't make out a normal mucosa. This ought to be mucosa, and it's not there. I've seen the syncytial formation and the inclusions. A bird that managed to fight it off for a few days, and a younger bird, and this is his bursa again, and these are herpes inclusions and syncytia. Let's take our break, and we'll come back to, because I want to go on to the next manifestation of herpes then, and we can go from there. But let's go ahead. It's 10 till the hour. This can be carried for a long time by several different species. The classic one you've heard about is the conure. And I get history. I'll tell people I get histories of all of a sudden a lot of deaths in the aviary, and last week they brought in a new conure, and I said, yeah, they brought in a hit conure. And he did it. Conures, Patagonian conures in particular, carry this thing, and then everybody else starts dropping dead. The carrier conures can sometimes come down with clinical disease, and I will say this, the lesions are usually somewhat atypical, and you have to hunt for inclusion bodies, and if you're looking at a conure, that's something to keep in mind. The other Amazon parrots also carry this disease, particularly blue fronts, but also others, and they can carry it for a long time. And we have typical history, and I've seen this in very well managed aviaries that are closed aviaries, nothing in, nothing out, the owners don't go to bird shows, et cetera, and all of a sudden one Amazon or a pair of Amazons in one cage will just drop dead, boom, one today, one tomorrow. Classical Pacheco's disease, nobody else gets it, nobody else had it. They got stressed somehow and the virus got loose. We had that happen in a group of macaws too, and so I'm suspicious that the macaw can carry this thing around if he wants to. Another manifestation of this type of herpes virus is the so-called Amazon Tracheitis virus, or the cytosine equivalent of LT, I guess. Problem is, I personally don't see it in continental United States. I don't know about the other guys, but the only ones I've ever seen have been out of Hawaii. But you do get necrosis, hemorrhage, and changes in the upper respiratory tract and on down through the lungs. And this is an example of the nasopharynx, syncytial cell formation, inclusion bodies, some hemorrhage, some necrosis. And in the lungs, you'll see these syncytial cells really marked, and a variable amount of collapse of air capillaries, exudation into tertiary bronchi, macrophage mobilization, what have you. Here's what makes the diagnosis for you. Amazon Tracheitis virus is probably just another strain, and it's really seems to be more a European disease. And as I say, it probably exists in the continental U.S., but I don't get any cases. And why in Hawaii, I don't know. Maybe they imported the bird. Another example with a little more collapse, more congestion. Again, the typical syncytial formation, which is what I see, fibrin and inflammatory cells in the tertiary bronchi. It's just IMAG. All right, there's two other things that fall under the rubric of herpes virus, and one of them has been identified as a herpes based on the only work that was done with an electron microscope was a thing we see primarily in macaws, occasionally in cockatoos. I think I've seen one in an Eclectus parrot, and this is on the non-feathered skin. You get swellings and you get discoloration, depigmentation, and in the macaws, it's kind of diffuse and it's not sure what you're looking at. In cockatoos, it can be a little more proliferative. But the reason I did this is if you'll note, it has this Turkish towel look to it. I don't know how else to explain it. And it's just that color and that sort of look to it. And it's swollen and what have you. And when when you look at these things, and this is the skin, you've got acanthosis, you've got a lot of parakeratosis, you get variable amount of dermatitis. What you have is large inclusion bodies, intranuclear, there's a paranuclear halo. These are the remnants of the inclusion bodies out in the parakeratotic layer. Sometimes that's all you see. On EM, this thing was identified as some kind of a herpes. It's probably a cytomegalic herpes of some sort. This is a very sporadic. A lot of the avian practitioners, pretty much after they get a diagnosis once or twice, they recognize this thing. And so they'll see it and they'll start painting these things with acyclovir and what have you, and they can keep it under control. So it does have some indication that it is herpes, but it's not been well worked up. I don't think anyone's ever done any virology on it to mount to anything. The other, well, it's just a higher mag to show. And one thing you don't want to confuse it with is Polyoma virus, obviously. One of the things to look at is the fact that you've got this big intranuclear inclusion with a paranuclear halo, and it is cytomegalic. I don't know, it's different, and it's usually, it's going to be localized primarily to the lower legs and feet of these birds, and mostly in macaws, less in cockatoos, and less in everybody else.
Circumvirus, the epithelium is more necrotic response rather than...
Yeah, exactly, yeah, exactly. Circovirus, rarely. I've seen a few cases where circovirus lesions were in the surface epidermis. They're almost always confined to the epidermal collar, occasionally to the feather follicle, but to the follicular epithelium. Now, out of Europe, there have been reports in finches or canaries of a true cytomegalic herpes causing a respiratory disease. That disease is in the United States, at least it was. It was in New Jersey a couple of years ago. That's where this material comes from, but it has not been reported. The reason it hasn't been reported is because two of the other people that worked on it I can't move them. They're across the country, and I can't get at them, and they won't get the stuff out. So it hasn't been reported, but this is a case where we had a lot of rhinitis, a lot of sinusitis, and it went on down tracheitis, mostly what you'd probably call a mucoid or catarrhal look to it grossly. This was the kind of thing you were looking at. Histologically, though, there was a variable amount of necrosis in the upper respiratory tract. And what you saw with the mucosa was this kind of change. And it looks, if you think of inclusion body rhinitis of swine, I think that's probably as close as it comes. Variable inflammatory lesion. But this is a cytomegalic herpes. It's reported out of Europe. It's reported out of Australia. It at least has occurred once in the United States, and so it's something to keep your eyes open for. We'll look at a few more of the inclusion bodies, if you like inclusion bodies, and other changes in the epidermis. You can see the various proliferative and necrotic changes. Okay, let's cover some RNA viruses. Paramyxovirus infection. We heard a lot about Paramyxovirus infection this morning. Where I see the most Paramyxovirus is in the Australian grass parakeets, the Neophema species, of which this is an example. These are small parakeets, and there's a variety of them. There's the rosy borks and the two or three others, but they're all basically Australian grass parakeets. And what you have is this typical posture, or maybe they're looking down between the legs, they're up like this, they're the stargazers and what have you. And the first thing people tend to think about is, oh my goodness, we've got encephalitis of some sort. And so they whack these birds and send you the brain, and you report back that there are no lesions, sorry. And so they think, well, that guy doesn't know anything about pathology. The problem is that most of these are vestibular. Rarely are they encephalitic. They're mostly vestibular. Now, I do see some encephalitis, but not very often. Usually they're vestibular. And so you've got a variable amount of necrosis, cell swelling, inflammatory cell infiltrate, mononuclear infiltrate in the middle ears, in the inner ear, involving cochlear membranes and all of those nice little structures in there. So when I get these things, what I do is I decal them, and then instead of longitudinal, I cut them right through I cut a transverse right through the ears, and usually you can prove it when you do that. If you use your imagination, you can see some inclusion bodies. They are there. They're hard to see. Sometimes there's almost some syncytia, not quite. And Paramyxovirus, as you recall, some of the morbilloviruses can also cause a syncytial cell formation. But usually there's intranuclear inclusions, non-suppurative inflammation. Sometimes I see a choroid plexitis. This is not a choroid plexitis, but sometimes I see a choroid plexitis, sometimes, and very rarely an encephalitis, but these kind of changes. Now, you also have the true Paramyxovirus. Well, let's not get ahead of ourselves. The other outstanding feature about this disease in neophemas and also has been reported out of Europe in some passerines is pancreatitis. In particular, it's a multifocal lymphocytic. They're almost, as you can see, lymphoid follicle formation in these pancreases. There's a variable amount of acinar atrophy and some true necrosis, a lot of loss of zymogen. This is a moderate case. It can be almost wall-to-wall confluent follicles. Many of these birds, we're trying to work this up now, and we're trying to get our amylase values in a row, because our feeling was that once you go over 1,000 on the amylase on these, then it's pretty characteristic. This is how you can diagnose this thing, with or without. And the reason for this, to get a diagnosis, is because these people have an aviary full of these birds. Only a few of them are showing signs, and they'd like to know who else is infected without killing them all. So we've been working on that because we've seen the high amylase values. Well, we're starting to get some incongruous looks with the pancreatic biopsies, and so I'm not sure that's going to work, but we're trying anyway. But this is the kind of thing you see, and when you see this kind of pancreatitis and you've had a neophema and you've got the other signs and what have you, or even if you don't have them, then it's usually paramyxo. And on these where we've gone, sent them off for any kind of virological exam, what usually comes back is non-Newcastle Paramyxovirus. They don't take it any further. And as you know, there's a long list of Paramyxoviruses that have been reported out of cytosines and passerines, and the virologists have these all neatly classified. But in this country, most people are just worried about, is it Newcastle or isn't it Newcastle? If it isn't, they don't care anymore. We also see some classical encephalitis, probably viral and associated with paramyxo. If you're lucky, you can find cytoplasmic inclusions, on electron microscopy. These are paramyxovirus inclusions. Could this be Newcastle? Sure it could. That one never had any diagnostics done on him except EM, so we don't know. That's the one that scares the regulators real bad. But the problem is, at this point, if he's the only bird, all you can do is say, hey, watch the next bird. We got to do something else on. And those are, in terms of paramyxovirus, that's pretty much what I see in the pet avians. If I have any suspicion at all that we have anything that even looks or smells like Newcastle, what I do is I just put them in touch with the state regulatory people and say, you got to follow this one up. Reovirus has been argued about in parrots, and there's a couple of reports of it causing hepatic necrosis, more hepatic necrosis, multifocal necrosis. This virus does not cause, you do not get in cytosines at any rate, you do not get inclusion bodies on light microscopy. You have to do EM to find virus. It's somewhat questionable, as I say. It's been reported. I think there's also, when it was reported early on as being an African gray parrot problem, and I think they confused a lot of them with probably what was really Circovirus, and again, they didn't look at the bursus. But it's out there. You may get some question or some thing on it that refers to it in parrots, and know that it exists, but know that it's pretty vague stuff and nobody's working on it. This is the kind of little more extensive necrosis. Non-specific hepatic necrosis, no inclusion bodies, and after you convince yourself that none of the other viral diseases will work, then you can probably, unless you have an EM or can go on, if you do that, then you can make your diagnosis. But if you don't, you're stuck. Okay, Togavirus. Where do we see Togavirus in pet birds? Well, a couple years ago, out of Florida, is a report on a condition called avian serositis, or due to avian serositis virus, which is a Togavirus. And it may be something that the parrots got from the chickens, or who knows. Mostly in macaws, but that's not the only species affected. And what you see is a young bird that is presented with ascites, and he's got a big, full belly. And when you open him up, you start to see something like this. Like this, you've got a lot of acidic fluid. You may have some changes in the heart, because you can get some myofiber necrosis and some changes in the heart. This is another disease that morphologically, you look at this and you say, okay, that's what it may be, and I've got the right kind of bird and it's the right age, but unless you can get some virology backup, you can't make the diagnosis specifically, because this could be Polyoma virus very easily. And if faced with a gross photo like this, and you see a lot of the ascites and everything, those are the differentials if they ask for it. If they don't give you some kind of clue as to where they want you to go, here's another example of hepatic problems and ascites, and so could be polyoma. I'm sorry, say again?
Any other histologic lesions with that?
Histologically, about the only thing you look at the serous membranes and what have you, and you've got a bunch of ragged, you've got necrosis, you've got slightly pleocellular infiltrate, mostly mononuclear. In some cases, you end up with secondary bacterial problems because something's happened with the gut, but in most cases, it's very nonspecific. There are no inclusion bodies that I'm aware of on light microscopy, and so you have to go to EM or some other way to make the diagnosis. And so this one is usually made because of the bird and because you've eliminated everything else. The other Togavirus that I see has to do with emus, and we'll consider pet emus for right now. And of course, it's been reported, both eastern and western have been reported and proved. We in California have only seen the western. Equine encephalitis, if you will. It's toga. These animals will have some CNS signs. They often do not have any CNS lesions. What we've seen is a lot of hemorrhage, and then primarily vascular changes, fibrinoid degeneration and vasculitis. And appreciate those of you who do poultry that Newcastle can do this in a chicken. And the first cases we had was the flag raised right immediately. Uh-oh, what do we got here? We hope it's Togavirus. That's when you hope it is, and it proved out. But it was worrisome for a bit. And so you do see this kind of splanchnic vascular fibrinoid necrosis and what have you. As I say, emus seem to be the only one of the rat types that's really affected. I haven't seen it in ostriches. The problem with the CNS disease, with it being a CNS disease in emus, is they get 3 or 4 CNS diseases, and then you've got to start running those down. And, yeah, I like that one. Into this, I'm only going to talk about one in this category. I believe that I've seen some changes in some of these birds in their guts that look like corona rotavirus type changes, as you see in the pigs and some of these other things.